Are you aware of the hidden risks in your workplace? This module explores the impact of conflict, stress, drugs, and alcohol on workplace well-being. Learn how these factors affect absence rates, performance, and employee retention. Conflict at work is common, but can be dangerous if unmanaged. Disagreements and clashes are natural, but some escalate into serious issues. Recognizing early signs of conflict is crucial. Escalation can lead to bullying or harassment. Protecting everyone involves knowing what actions to take. Workplace conflict often stems from workload, communication, and performance issues. Unfair distribution or unclear priorities can cause tension. Misunderstandings and blame culture further escalate problems. Personality clashes and changes in management add to the friction. External pressures also contribute significantly. Look out for verbal escalation, like raised voices and sarcasm. Personal attacks and refusal to communicate are red flags. Behavioral changes, such as avoidance of meetings, are concerning. Cliques forming and others taking sides worsen the situation. Physical posturing indicates further escalation. Stay calm and match your demeanor to desired outcomes. Listening without interruption is crucial. Acknowledge the other person's feelings, even if you disagree. Find common ground to move forward. If unable to de-escalate, step away and document the incident. Stress arises when pressure exceeds coping capacity. A bit of pressure can motivate, but sustained pressure harms. Work-related stress is the top cause of long-term sickness in the UK. Recognizing stress symptoms is essential for intervention. Addressing stress is crucial for safety. Talk to your manager early about stress concerns. Taking breaks and avoiding work through lunch is vital. Physical symptoms are important data points. Employee assistance programs offer valuable support. Maintaining healthy sleep, diet, and exercise routines is beneficial. A stressed worker poses higher safety risks. Fatigue and distraction lead to errors and shortcuts. Stress management is integral to safety management. Incidents often involve human error linked to stress. Addressing stress is a fundamental safety measure. Drug and alcohol misuse at work endangers everyone. Workplace policies prohibit being under the influence. These policies aim to control risk, not private lives. Alcohol and drugs impair reaction time and judgment. Prescription drugs can also affect work safety. Substances slow reaction times and impair judgment. Coordination issues arise, especially in safety-critical tasks. Aggression and mood swings affect workplace harmony. Hangover effects persist, posing risks even after consumption. Prescription medications may also impair work abilities. Employees must not be impaired by substances at work. Inform managers if medication affects safety-critical tasks. Drugs and alcohol should not be brought onto the site. Honesty is crucial if struggling with substance issues. Employers often provide support for early intervention. Internal channels should be used first for concerns. If unresolved, external escalation paths exist. Avoid premature escalation. Follow the designated route. External bodies provide support when internal routes fail. Knowing escalation procedures is essential for resolution. HSE handles health and safety concerns anonymously. ACAS addresses employment relations issues. Trade unions offer trained representation for members. Whistleblowing protections cover serious concerns. Employment tribunals resolve disputes on employment rights. Whistleblowing involves raising workplace wrongdoing concerns, protected by law if in the public interest. Internal resolution should be attempted first. Whistleblowers cannot be dismissed for protected disclosures. Helplines offer guidance on whistleblowing procedures. Notice behavioral changes in colleagues like withdrawal. Asking twice can uncover hidden issues. Listening is key, but don't act as a counselor. Serious disclosures require serious follow-up. Prioritize self-care to effectively support others. Reflect on recent concerns raised at your workplace. Consider how they were handled and potential improvements. Identify unresolved conflicts within your team. Recognize personal stress signs early for intervention. Familiarize yourself with workplace drug and alcohol policies. Health and safety responsibilities start with you. This module covered legal duties and practical skills. Understanding is assessed, but practice is key. Implementing knowledge protects you and colleagues. The real test is applying what you've learned. Most issues resolve through early manager discussions. Conflict is normal but dangerous if unmanaged. Targeted banter is legally considered harassment. Stress leads to long-term sickness absence. External routes exist if internal escalation fails. What is the first step in resolving a workplace problem? Name 3 sources of work-related conflict. What are the 6 HSE management standards for stress? Why is being hungover at work a safety issue? Who to contact if employer doesn't respond to safety concerns? Explore recommended books like HSE Guidance on Stress. Visit websites for stress management toolkits. ACAS offers resources on workplace dispute resolution. Case studies provide real-world examples of interventions. Further reading deepens understanding of workplace well-being. Workplace well-being is foundational to safety. Recognizing and addressing conflict, stress, and substance misuse is crucial. Implementing these strategies ensures a healthier, safer work environment.